Thanks for being with us this afternoon. I'm Scott Wickersham.
I'm Erica Bryant. The coronavirus is forcing us to spend many more hours at home, but police say that more people are committing crimes during this time of crisis.
Channel 9's Mark Becker just spoke to CMPD in the past 30 minutes, and they told you about an uptick in two specific types of crimes. Mark?
Yes, Scott. Overall, police say life is going on, of course, and apparently so is crime. It's about flat from where we were last year at this time. But there are some changes in our lives that have brought certain particular crimes into their concerns, and two of them specifically they talked about this morning. First of all, they say they've seen a spike in the shootings into homes and other occupied dwellings. They've reported 60 more in March than they had in March of 2019. That's an increase of 80%. The real concern, of course, is that a lot of people are being asked to stay at home and could be in the path of those bullets. The other concern is domestic violence calls. They've had 517 more calls for domestic problems this March than last March. Now, that's an 18% increase. Again, that may not be a surprise, given that more people are at home and conflict is probably inevitable in situations where people have not been able to get away as easily. Now, they did stress this morning that there are resources out there. Here in Charlotte, for example, Safe Alliance. But they also say, if you have a problem, don't hesitate to call 911, because despite all of this, police are continuing to answer calls, emergency and in some cases non-emergency calls as well, but they are very concerned about those two specific crime areas. Scott?
All right, Mark, thank you. And conversely, Medic at the same time is dealing with fewer emergency response calls.
Yes, Channel 9's Gina Esposito live for us. Says Gina, responders say they are still being very cautious during this time.
Yeah, with many people at home, Medic says that 911 calls are actually down, especially those calls involving traffic accidents, because fewer people are out on the roads. Medic says between March 18th and they said that they've averaged about March 18th to March 26th, Medic has averaged about 280 transports a day. Compare that to the same time last year, it was 321 transports, or about 40 fewer a day. While Medic is transporting fewer people, they're still being cautious on every call they respond to. All 911 calls are being screened for patients with COVID-19 symptoms or those considered high risk. Last month, Medic showed us the protective gear paramedics are now required to wear while interacting with a patient with virus symptoms. They wear gloves, an N95 mask, goggles, and a gown. I've learned that Medic has those N95 masks only to last them for the next couple of weeks. Coming up tonight at 5 o'clock, I'm breaking down some of their concerns moving forward and how they plan to address it to keep their paramedics and you safe. Back to you.
All right, Gina, we're hoping they get more of that protective material. Thank you.
Now, experts have suggested the number of cases will go down in the summer and could pick up again in the winter. The former director of the CDC talked about that this morning on CBS and said there's no evidence of that. He's optimistic the U.S. can gradually reopen if we all do the right thing. Now, in North Carolina, more than 26,000 people have been tested. Of those, more than 1,500 tests came back positive. That's about 6%, or basically saying 6 in every 100 people that were tested had a positive result. Mecklenburg County is showing 444 patients now. Here's a look at the South Carolina cases. 1,083 people have tested positive. 22 people have died. In all, 79 people in our area have tested positive.
Now we want to show you this video shot just moments ago of a contractor apologizing after he cut off the water multiple times in a Gastonia neighborhood. All of this happened after neighbors contacted our reporter Ken Lemon, saying they're outraged because crews are out there working on the water lines while health officials are warning all of us that we need to wash our hands frequently.
Yeah, Ken is live for us in that neighborhood tonight.
Yeah, Ken, it is good that they got that apology, but they say that's really not enough right now because we need to be washing our hands.
Yeah, it's not at all enough at all. People here in the Cedar Grove community are frustrated this happened at all. They're all on well water here, and they tell me this is a project that was supposed to start in the early part of last year and be done by Thanksgiving. But take a look at the cones here behind me, and you can see that this is work that started here instead in late December. It began as a sensible solution to problems here. The water was supposed to be shut off during the day when most people would be at work, and there was no concern about coronavirus then. Several neighbors told me they complained to the company that provides water when coronavirus became an issue, and experts started stressing hand washing as a solution. Now, the state instituted that stay-at-home policy, which means that the water was shut off when families were at home with no water to wash their hands. Now, one neighbor told me what her water company told her when she called. Then you'll hear what that contractor told me.
I think it's outrageous. And I even pleaded to the guy, tears in my eyes. You knew about this project. You knew that it was coming. There's absolutely nothing I can do for you.
I agree with it. I mean, I agree.
Yeah.
But we're just doing what we're told. I mean, we got bills to pay just like everybody else.
And you saw in that video earlier that contractor did apologize to her. He said that the work here was done, and she says she'll believe it when she sees it. She says this was a 9-month project. They're barely 4 months into that project. Now, I reached out to the company that provides water in this area, and I found something very interesting when I went to what appears to be their website, a posting they made at the height of the coronavirus. As part of a story I'm working on, I'll bring for you tonight starting at 5 o'clock. Erica.
All right, Ken, we'll look forward to that update. Thank you.
New this afternoon, an interview with the Surgeon General, and in this interview, they said that they're taking another look at the guidance on whether or not people should be wearing masks out in public. Here's ABC's Andrew Dimebert.
I want every American to be prepared for the hard days that lie ahead.
The president with a somber tone predicting a painful 2 weeks ahead for the nation. Top officials on his COVID-19 task force now believe as many as 240,000 people could die from the novel coronavirus, even following the administration's social distancing guidelines.
They're very sobering. Yeah, when you see 100,000 people, that's at a minimum number.
As health experts and federal leaders try to slow the spread, the Surgeon General telling Good Morning America the time for all Americans to wear masks in public could be imminent.
We've asked the CDC to take another look at whether or not having more people wear masks will prevent transmission of the disease to other people.
In an effort to curb the pandemic, the president has extended the administration's guidelines for social distancing until at least April 30th, but still refuses to issue a nationwide stay-at-home order, leaving it up to the state governments to decide.
Unless we see something obviously wrong, we're going to let the governors do it.
Meanwhile, the disconnect between states and the federal government on supplies is mounting. Some governors say they are short on critical COVID-19 equipment like masks and ventilators, looking to the White House for guidance, while bidding against one another for life-saving tools.
We are paying $25,000 per ventilator, and we are broke. And the last thing I want to do is buy a single ventilator that I don't need.
And lawmakers are already discussing another $2 trillion stimulus package, and the president says he wants it to focus on infrastructure. Andrew Dimbert, ABC News, Washington.
Also starting today, food stamps program, the one known as SNAP, is offering more benefits even for people who might have just barely qualified for it before. A family already enrolled will now get the maximum amount for their family size, regardless of any other qualifications. So, for example, a single person whose income barely qualifies for assistance might usually get $16 a month. Well, now they can get the max benefit of $194 for March and again in April.
Really excited about the flexibilities that our federal partners have been able to leverage all across the country to help families in need.
If you apply now and you meet the requirements, you'll get the maximum benefits for April, even if you're not approved until May.
Well, some families in our area will get fresh lettuce thanks to some local high school students. Myers Park High School donated these containers of lettuce to a nonprofit this morning. The containers are being stored right now at Catawba Brewing, and they will be distributed later on today. All this lettuce came from the school garden. That's where the students grew more than 300 servings of lettuce a week. They're hoping that it gives people who are struggling a much-needed boost.
Fresh produce gives us energy, it boosts our immune systems with a variety of different antioxidants and vitamins. So it's definitely important for our mental health, our self-care.
Yes, it is. This lettuce will be donated later on today in the Belmont neighborhood of Charlotte.
Well, despite everything going on with coronavirus, officials still trying to get people to fill out the census questionnaire this week. Well, today's National Census Day. Documents like this have been going out to Americans in the mail for weeks. You're required by law to respond to the questions. Of course, all this is to count Americans. It's a big deal because it'll determine how many representatives each area will get in Congress and how much each state can get in funding. Also affects how much federal money will go to local schools and construction projects near where you live.